Hi, this is Mary. Hi, Mary.
Hi.
Mary is a very special patient. She's been a patient almost my whole practice career, and she came in. She has a history of some lung issues over many years. Mary, would you just like to share a little bit about your lung history for a minute?
My lung history includes such things as um, respiratory arrest, hospitalization for um, severe congestion. I
Asthma
asthma. I have asthma, and so
and also right the use of multiple breathing medications, right?
I've been on just about every kind of assistance to my breathing that the medical profession can give me. So I've done this for most of my life.
Yeah, and so we were in January. You came down for treatment. Why don't you share just kind of what was going on then?
In January, I started to not feel well. And when I don't feel well, the first thing that's going to happen is I'll get like the sniffles, and the next thing it'll go directly to my lungs. So I knew I was starting to be in trouble, and I came to Dr. Joe to have a treatment. And he gave me the vehicle to be able to get much better faster without a lot of intervention.
Well, so our concern was you came in, correct me if I'm wrong, and you sounded rough, and I asked you to cough, and you had a deep, terrible sounding cough. And if history were to repeat itself, what was our big concern on history repeating itself?
Well, when I get to the point where I'm having that kind of a reaction, it goes deeper. My breathing gets much, much, much worse, and I end up in the hospital. And I do not ever want to go back to the hospital. And I knew that coming to see Dr. Sibley would be the answer to it. And he was able to give me many supplements so that I could get stronger and my lungs could get better without having to go into the have a hospital intervention.
Yeah, so I just said, Mary, what do you want to do? She said, I don't want to go to the hospital. So we wrote up a protocol and 5, 6 products, and that was like on a Wednesday.
Yes.
And I actually called you on the weekend just to check in and see how you were doing. And
I felt much better, much better. And I came down the following week. I got another treatment, and I was feeling like 110% better. And so I rushed to get off of everything, and it was a little. I should have
premature.
taken more time for myself, and I should have continued the medications for a little bit longer. And what happened was
Actually, the supplements, right? Not
the
medication.
supplements
Yep.
longer, and um, so I start. I just resumed my life, and then after you resume your life, you stop paying attention to not feeling well, and it came back.
You got busy.
Very busy.
Life started up again, got busy.
Very
So about 3, 4 weeks later, you were back in, and you said, I'm going back.
I'm going backwards and not forwards, and I got treatments. We put in a couple extra supplements to really knock it out, and I did not quit my supplements as quickly, and I'm fine. And I feel really good about the fact that there wasn't a hospital visit in this whole situation, and I need to take time for myself.
Cover your mouth and cough for us. Let's just hear how your lungs sound. No, I mean, yeah, it sounds, I mean, you're clear.
I'm clear.
Yeah. So, Mary, do you have any advice for future patients who might be suffering? Not that there's not a time and a place to see the medical doctor and, do more drastic interventions, but what was really impactful for me was, and having known your history and how severe it has gotten in the past with bronchitis and pneumonia and even close to respiratory arrest because of your lung issues. I was kind of amazed myself as to the degree of response you had in such a short period of time. We high dosed the vitamin A, we high dosed
Yes.
vitamin C. You were on your lung support nutrients, and you were drinking the tea,
Yeah.
correct? And yeah, we just really were aggressive, and that was enough to give your body the resources it needed to bounce back.
Yes, and bouncing back is a lot easier when you're not deathly sick.
Yes.
And you can bounce back with the supplements as opposed to going through the medications, getting in the hospital, getting all that other kind of support, and having spent time in the hospital for lung issues. It's way easier to just, you start feeling sick, you come down, you get your you get your supplements, and you feel better as a whole.
We did laser on your lungs, and we did electrotherapy, and we just hit it aggressively, and it's wonderful to see you back.
I feel much better.
Yeah, so that's awesome. Mary, do I have your permission to share your story with doctors, students, or patients anywhere?
Sure.
Any restrictions on that?
No?
Thank you so much for taking a minute to share your story.
Thank you.
God bless your day.
You too.